I'm sure all of you have come across this word miscarriage. Miscarriage means pregnancy loss. Now, when this pregnancy loss happens before 13 weeks of pregnancy or 3.5 months of pregnancy, it is called an early miscarriage. Now, the first and the most important thing that you should know about early miscarriage is that it is quite common, especially in the first pregnancy. About 15 to 20% of the first pregnancies can miscarry before 13 weeks, sometimes even before the woman understands that she is pregnant. The good news about this is 99% of these women, when they go in for the second pregnancy, they have an absolutely healthy journey throughout the pregnancy. Now, what can be the causes of such early miscarriages? The most common cause is a chromosomal defect. When the egg and the sperm combine together to form a tiny clump of cells called embryo, there is an exchange of chromosomes. Now, the chromosomes are sticks in your body that carry the genes. So, an embryo will have 23 chromosomes from the father and 23 chromosomes from the mother. So, total of 46 chromosomes. Now, if for any reason during the combination there has been one chromosome more or one less, then it becomes an abnormal pregnancy, and then most of these pregnancies will fail before they can reach up to 8 to 9 weeks of pregnancy. Now, whenever a pregnancy loss happens, a lot of times a cause is inflicted on the woman, or it is self-inflicted by herself that I have done something wrong which has caused this miscarriage. बाहर का खाना खाया, घूमने गई थी, काम करती थी प्रेगनेंसी में, चाय कॉफी ज़्यादा पीती थी, etc. etc. Whereas the truth is, nothing much is in your hands any which ways. Please remember this, that spontaneous miscarriage is not your fault. Working, exercising, having sex, or having birth control pills before pregnancy does not cause a miscarriage. Things like morning sickness, having tea or coffee, having a sudden fright or a loud noise do not cause miscarriage. Alcohol and smoking are related with early miscarriages and late complications, and there has not been an established level that is safe during pregnancy. So it's a good idea to avoid alcohol and smoking completely during pregnancy. Are certain women at an increased risk of miscarriage? Yes. Women above 35 years of age, women who smoke or use recreational drugs, women with previous miscarriages, those having medical problems, or those having poorly controlled or uncontrolled diabetes, high blood pressure, or thyroid disorders, and obese women. How do I know that I have a miscarriage or I am going to have a miscarriage? The most common symptom is bleeding and a little bit of cramping. Now, a little bit of bleeding during the pregnancy is okay, but if the bleeding is continuous, if the bleeding doesn't stop on its own or is in large amounts, it's a good idea to see your gynecologist, to see your doctor, and the doctor will run some tests like sonography and blood test and then tell you about the pregnancy status currently. Now, if the ultrasound shows that the baby has a good heartbeat and the baby's sac or the pregnancy sac is well placed in the womb with a regular shape, the chances that the pregnancy will continue as a healthy one is almost 90 to 95%. However, if the ultrasound shows that the baby's heartbeat has slowed down, or the sac is irregular or is placed down in the womb, then the chances of miscarriage is as high as 70 to 80%. Sometimes the ultrasound might show that the miscarriage has already happened, a large part of the pregnancy has come out, and there's a little part of the pregnancy which is left behind. At that point of time, there is nothing much that one can do. The doctor might decide to clean the womb or give you some medications to self-clean the womb. Your first sonography should be done at least 6 weeks after your first day of last menstrual period, or the LMP as we call it, because that's the minimum time that is needed to detect a heartbeat by an ultrasound machine, that too with an internal scan. Now, if a heartbeat is not detected by 6 weeks, one should repeat the ultrasound after 10 to 14 days Most often we see that the heartbeat is normally detected by this time. Can a miscarriage be prevented? Well, that depends on what condition you are now, whether you're pregnant or you're not pregnant currently. If you are not pregnant, a lot of things can be modified, like correcting certain habits, getting a control on the medical conditions, getting tested for infections, immunity, getting vaccinated, etc. If you are, however, pregnant already, then things are not much in your hands. Bed rest usually does not prevent a miscarriage. We do advise off from work just because we don't want to add on certain factors and to keep the uterus quiet to kind of accept the problems that's going on with the womb. However, a bed rest or off from work will not correct a chromosomal abnormality. Sometimes your doctor might give you certain tablets in form of aspirin or in form of progesterone to prevent a miscarriage. When may I plan a pregnancy again after a miscarriage, after an early miscarriage? Well, the answer is that whenever you are psychologically ready to have another pregnancy. There is no evidence, there is no scientific evidence that giving a gap of 3 months or 6 months can prevent a miscarriage. Physically, you are ready to have another pregnancy as soon as you get 1 natural normal periods after an early pregnancy loss. Please remember that early miscarriage is usually a one-time event. There is a very little chance of this miscarriage getting repeated. But it's a good idea always to have a pre-pregnancy counseling at least 3 months before you're actually planning for a pregnancy to prevent a miscarriage and also to prevent complications during the pregnancy. Thank you. To contact me, please write at drsudeshnacares@gmail.com.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.